Hello there, welcome to another episode of Rare Diseases. Rare Disease Review is a not-for-profit medical journal organized by students from University of Toronto, McMaster and Western University. This podcast is created by the branch of Western University. This podcast aims to advocate for rare disease awareness and promote student involvement in the rare disease community. We appreciate your listening and support today. For further information on scientific translation of rare disease information, please visit www.rarediseasereview.ca. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So please always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. My name is Zheng and you're listening to the Rare Disease Podcast. For this episode relating to our published journal review in January, we're taking a peek at one of the rarest, most severe, and most complicated type of congenital heart defect, the hypoplastic left heart syndrome. Hypoplastic left heart syndrome is a congenital heart defect, meaning that it's a heart condition present from birth. In hypoplastic left heart syndrome, the heart's left side, including the aorta, aortic valve, left ventricle, and mitral valve is underdeveloped or absent. It represents 2 to 9% of congenital heart disease cases and accounts for 23% of neonatal death from congenital hormone functions. Before birth, the fetus heart can bypass an underdeveloped left side of the heart and deliver oxygen-rich blood throughout their body thanks to the patent ductus arteriosus and the patent foramen ovale, which are opening between left and right side of the heart. It allows the right side of the heart to pump blood to the lung and the body in the first few days after birth. However, within these few days, the opening closes up and the symptoms caused by an underdeveloped heart develop quickly. The symptoms can include breathing, difficulty pounding heart, weak pulse, or bluish skin color. The cause of hypoplastic left heart syndrome is not known in most children. It occurs in normal babies without a known reason, but in some cases, it can be accounted for by genetics. These cases are associated with mutations in the GJA1 gene with autosomal recessive inheritance or NKX225 gene with autosomal dominant inheritance. It is also associated with certain genetic disorders including Turner syndrome, Jacobson syndrome, trisomy 13, and trisomy 18. It is also associated with environmental factors including a decrease in folic acid, smoking, and drinking alcohol in pregnant mothers. These interactions are not specifically identified and are under research. The diagnosis of hypoplastic left heart syndrome can either occur prenatal, meaning that during pregnancy, or in postnatal, meaning shortly after birth. During pregnancy, an image of the baby's heart is taken through a non-invasive specialized type of ultrasound called fetal echocardiogram. A fetal echocardiogram identifies any malformation or defect of the fetus related to heart development. After birth, the diagnosis relies on observing signs and symptoms, which usually develop rapidly within hours or days. The clinical presentation of hypoplastic left heart syndrome occurs most frequently between day 1 and day 3 of the life. This includes cyanosis, the blue discoloration of the skin, lethargy, a weak pulse, and problem with breathing due to insufficiently oxygenated blood in the circulation. And newborns showing these symptoms get further evaluated with an echocardiogram and newborns pulse oximetry tests to visualize the heart and to determine the level of oxygen within the blood. Most infants die within the first 3 weeks, and some survive beyond 60 days without surgical intervention. The survival of infants of hypoplastic left heart syndrome requires meticulous attention to balance the systemic and pulmonary circulation, especially during the hemodynamic changes in the newborn period, which means critical development of the heart circulation during the newborn time. If left untreated, hypoplastic left heart syndrome is fatal. The current survival rate of patients are improving thanks to novel surgeries. In the past 2 decades, palliative surgery and cardiac transplantation have management options. The Norwood surgery is the first of the 3 surgeries that facilitates correcting defects. The surgery has 3 to 5 year survival rate of 70%, while those survive up to 1 year of age have long-term survival rate around 90%. The surgical therapy provides hopes for survival of these infants, but their long-term outcomes are not well defined. This is because surviving a hypoplastic left heart syndrome is understood to increase risks of other diseases such as thrombotic complication, including stroke, a decreased ability to exercise, and an increased risk for neurodevelopmental impairment. Comfort care is either at home or the hospital as an acceptable management option, and more investigation to long-term outcome of following surgery is still needed to be determined. The treatment for a baby born with hypoplastic left heart syndrome starts with immediate admission of neonatal intensive care. The primary goals are to keep the baby breathing and to keep the ductus arteriosus open. As mentioned before, the ductus arteriosus is an opening between the aorta and pulmonary trunk that allows blood to bypass the underdeveloped lung of the fetus and to be sent to the rest of the body. This opening is in the fetus when they are in the uterus, but it closes at birth. A medication called prostaglandin E1 is administered to keep the ductus arteriosus open for blood to pump by the right ventricle to the entire body. As babies enter stable stage, surgery that reconstruct heart structure and restore heart function to a certain level can be an option. In surgery therapy, 3 surgeries are taken at critical time points to restore certain proportion of the heart function, but not the full function. The Norwood procedure is done at the 2 weeks after birth, and hemi-Fulton procedure is done at 4 to 6 months after birth. Finally, the fenestrated Fulton procedure is done at 18 to 30 months after birth. The initial phase of Norwood procedure is the construction of an unobstructed systemic blood flow from the right ventricle to the aorta. The restricted pulmonary blood flow through a systemic to pulmonary artery shunt. Subsequent procedures are designed to facilitate the transition to a physiological normal circulation with the connection of superior vena cava and the inferior vena cava to the undivided pulmonary arteries. The last stage involves the closure of fenestration, which is performed in the cardiac catheterization laboratory. The final result is the right ventricle pumping oxygenated blood through a reconstructed aorta, and venous blood returns directly to the lung. The hospital survival rate is up to 94% to 98% following the hemi-Fulton procedure. A concern for infants with hypoplastic left heart syndrome is the central nervous system. Studies find that infants surviving the condition can develop hypoplastic ischemic lesion and intracranial hemorrhage, and an association to congenital brain anomaly is proposed as well. Another option for the infant that are stable is cardiac transplantation. This offers the potential for a normal cardiovascular physiology, but the scars of donor heart makes this option a limitation. As stem cell therapy is being investigated to help the right ventricle to deal with increasing stress of pumping the blood to the aorta, the treatment for hypoplastic left heart syndrome is improving. In nearly 1,500 to 2,000 infants in Canada and the United States are born with hypoplastic left heart syndrome every year. The mortality of this condition is very high, making it responsible for about 23% of neonatal deaths. Sister by Heart is a support group for those affected by the hypoplastic left heart syndrome. Other nonprofit that supports the cause includes Heartbeats, the Canadian Heart and Stroke Foundation, and many more. Thank you so much for listening today, and have a great weekend.